Hi there, Dr. Mark Smith from Progressive Chiropractic here with our first installment of a clip I'd like to call Whiteboard Wisdom. And this is a segment where I dig in a little deeper to the message on the whiteboard for the week. And as I look outside at a very gray, rainy West Coast day, the topic is very appropriate because we're talking about depression and exercise. And so several points that I'd like to make about this. First of all, we're genetically designed for movement. As human beings, it's very important to our physiology. North Americans get about 1/3 of the activity that they should get, and movement is very important because it's like electricity for the brain. Okay, it provides input called proprioception, and proprioception stimulates what's called the movement pleasure pathways in the brain. In addition, it releases endorphins, and over time, it helps rewire our brain for happiness. If you're a person who sits at a desk all day, maybe by 2 o'clock you're feeling kind of foggy-headed, kind of tired, it's probably because you're not getting enough movement. If you were to get up and do some jumping jacks, do some push-ups, or go out for some more structured exercise, you can just about guarantee that you'd be feeling a lot better afterwards. And that's because of this proprioceptive input. And that's why a daily movement practice of exercise is so important. You're giving your body what it genetically needs for your brain and body to function properly. Mental illness is a very serious issue. It's something that a lot of my patients present with in the office. And when people are on these antidepressants for extended periods of time, their body becomes resistant to it. So that means that a person needs to take more and more of these antidepressants, more and more of these drugs with more and more of these side effects in order for it to be effective, because the body's becoming resistant to it. More and more drugs mean more and more side effects and less health. And so exercise is one of the key components of tackling this issue that you want to incorporate into your daily life. I found a really good source for some information on this, a study called The Benefits of Exercise for the Clinically Depressed by Lynette Craft. You can Google this. I believe it's in the Journal of Clinical Psychology. It's a really good read. Have a look through there if you so desire. And in the meantime, take care of yourself, get some movement every day. Thanks for listening.